When I was a little girl, I loved playing with baby dolls. And by the time I was 13, I knew I wanted to be a maternity nurse and help moms have babies. I was really fascinated with it. I decided to join the U.S. Air Force. I was in the Nurse Corps, and that's where I had my very first training to be a labor and delivery nurse. I loved being a part of that intimate experience with women and their families, giving birth. The most memorable days of their lives, and I got to be there. I got to be a part of that. It's such a huge privilege. I think the role of nursing has changed over the years, and they definitely have a lot more responsibilities. Having technology that's providing the data that nurses need to ensure that their patients are safe, not only mom, but that baby it's critical. Super, are you comfortable, Mom?
I am.
How does it
feel?
Feels
really good.
Prior to the pandemic, there was a nursing shortage, but that nursing shortage is only getting worse. The United States is experiencing a very high level of maternal mortality. It's important that we have a sustainable workforce so that the care we provide our patients is optimal. It requires us to rethink the way healthcare is delivered. Part of that is to come up with things that help our nurses. The great news is that new technology is coming on the market that helps nurses work more efficiently, that alerts nurses to problems with patients so that they don't have to always be physically present to find those things. So I'm optimistic that the pandemic is driving a level of change that's going to restructure healthcare in such a way that it's optimal for nurses and patients alike.
Cover her belly button. There you go. We know that labor can cause stress for babies. Every time that uterus contracts, there is actually a decrease in oxygen supply. So it's important that we monitor that baby's heart rate. Prior to the Novi technology, we either had external monitoring, which was with Doppler ultrasound, or we would have to place internal monitors. If a mom's higher BMI, that thicker layer of adipose tissue can make it really challenging for both the ultrasound technology and the tocotransducer technology to be able to adequately pick up contractions in baby's heart rate. Those transducers can slide around. They don't stay over the baby. They can, require constant readjustments. The Novi is able to pick things up differently. It's a completely different technology. It's actually listening to the electrocardiogram of baby and mom. It uses electromyography to measure contraction activity. Because it gets rid of those uncomfortable belts and mom's not strapped down to the monitor with cables, it's also giving her that freedom to be able to move around and stay active through her labor. We can't say that Novi is absolutely replacing other technology right now. We still need that other technology. There needs to be different options so that we can choose the best technology for that particular patient. It's another tool that's going to help give a more accurate, reliable trace for nurses, whether it's for an induction or just monitoring complications in pregnancy or getting mom through labor in a safe way. Zigzag, so UA, uterine activity line.
With my third baby, I was able to use the Novi, and with my first two, I was not able to. And I feel that my experience with the Novi was much better with this one as opposed to my first two, because I was able to move around the room. I had the freeing feeling, the empowering feeling. I could get into the tub and still have my baby's heart checked with the monitor. I was able to bounce on the ball and not have to fight with any monitors of trying to keep the baby on. Using the Novi helped relieve a lot of the anxieties that I had going into it, being a labor and delivery nurse, knowing everything that could happen.
Healthcare is looking for a big change, and the change needs to come from the bedside. It's important for nurses to have a seat at the table. Nurses are experts in the experience of the patient. Their voice is incredibly important because they are the ones utilizing the technology. They know what's needed, they know what our patients need, they know what the limitations are, and now more than ever, it's important to listen to them.
Hi, Lisa.
As a nurse working for GE Healthcare, I also have the opportunity to work with our product development team, and that's really important and crucial because, our product development team is mostly made up of engineers. They don't have the clinical background I have. They don't know what nurses need. So it's really important that they are constantly looking to us who have been out in the field to make sure that we are developing the right equipment to meet their needs.
Elijah and myself, we had an amazing birthing experience, and we're definitely grateful that technologies like this exist.
My hope for the future in maternity care is that technology will continue to evolve so that we can create safer environments and provide better quality care to ultimately get those moms and babies home healthy.